Awesome. So, hi, my name is Katie. I'm one of the peritoneal dialysis nurses at Abbotsford Hospital. I'm going to be going over a step-by-step approach to PD, just to give you a little insight into what it's all about. There are 6 steps that I will go through in detail and what to expect. You may have received this booklet from KCC, or you can find it online at BC Renal. So steps 1 and 2, is PD the right modality for me? On the left-hand side, we have a patient that is on automated PD, or we call the cycler machine. On the right-hand side, I have a patient who is on CAPD, which is continuous ambulatory peritoneal dialysis. So what exactly is PD? It's a type of dialysis that uses the lining of the abdomen to filter blood inside of the body. It's a dialysis solution that flows from a bag through a catheter that has been placed in the peritoneal cavity. The dialysis solution absorbs waste and fluid from the body. The dialysis solution, waste and extra fluids is drained from the body. What are some of the benefits of peritoneal dialysis? Well, one of the main reasons is home-based self-care therapy. It's which gives you a greater lifestyle, flexibility, and independence. It's a continuous therapy, much like the natural kidneys. Training time is short, and you'll spend less time at the hospital. You'll have less diet restrictions. It's needle-free treatment. It's increased travel opportunities, and PD is really gentle on the kidneys, which results in longer lasting kidney function. So what is needed to perform PD? So first of all, you need a PD catheter, PD solution, and a clean workspace. So steps 3 and 4, it's time to have a PD catheter inserted. So a PD catheter is a soft, flexible silicone tube catheter, which allows PD solution to flow in and out of the peritoneal cavity. And I'll just show you an example of a PD catheter. This is placed in the lower abdomen area. The Dacron cuffs, if you can see, are what holds the PD catheter in place. It's inserted in the OR, radiography, or at the bedside. The nephrologist will decide when one is appropriate for you. Insertion is considered when the GFR is around 15 or less. What does a PD catheter look like? So I'll just show you over here. Let's move this forward. So here we have the abdomen and where the exit site is, and the PD catheter. The PD catheter is attached to the Baxter transfer set and the twist clamp. Okay, and it goes inside just our little belt that we have. And also, just to mention, you will have a dressing that goes just on top, and that is changed daily or after a shower. So what to expect after the catheter is inserted? So the dressing will be changed by the PD program in approximately 7 days. No lifting of heavy objects, no bathing permitted, except for showers are fine after the exit site is well healed. Approximately 4 weeks after the PD catheter is inserted. Your PD nurse will let you know when showering is permitted. Step 5, PD training. So CAPD training usually starts 2 to 6 weeks after the PD catheter is inserted. CAPD training is an average of 5 days. It's usually Monday to Friday. ABD training, or the cycler training, is an average of 2 additional days at a later time. You and your support person will be provided all information to care for yourself at home. During training, you will learn how to do CAPD exchanges and APD exchanges, and how to keep clean for prevention of any infections. You also learn how to care for your exit site, how to solve any PD problems, how to monitor your health, and how to order PD supplies. So like I mentioned before, 2 of the PD modalities, so continuous ambulatory PD is a manual method. Majority of patients start on CAPD. And also the cycler, continuous cycler PD, which is the automated PD, and it's automated method. There may be clinical indications to recommend one over the other, but ultimately it's the patient's decision. So now I'd like to show you an example of the CAPD, or the cycler, the twin bags. So the twin bag consists of 3 phases. So I'll just show you here. We've got, you can see that, yeah, the catheter and the twin bag. And to attach, it'll be sterile, and you'll connect your twin bag to the PD catheter, just like this. So first you will fill with the PD catheter solution, which is called dialysate. You'll let it drain for 4 to 5 hours. And then after that, you will have a drain bag, which is attached, it's at the bottom. And that will drain all the waste and the water, okay? So it can be removed. Four exchanges are performed each day. Each exchange takes approximately 30 minutes. Each fill volume is approximately 2 liters to 2,500 mils. And there's always fluid in the abdomen. Now I'm going to show you the cycler, or automated PD. So we have our cycler machine, and it's pretty user-friendly. Basically, you'll have your cassettes, which can be removed and placed in the machine. And then you have your tubing on the side. And then the tubing gets connected to your 5-liter dialysate bag. And I'll just show you. Gets connected like this. And usually there are 3 bags total. This cycler machine, once you turn it on, it'll tell you a step-by-step process on how to set it up. The cycler is usually used at night, and it's usually about 8 hours. The machine automatically performs patient therapy by filling and draining dialysate throughout the night. The patient disconnects from the cycler in the morning, and in many cases is free to go about the day. The option to leave fluid dwelling during the day depends on your prescription. So PD solution. So the PD solution, which is in here, it removes extra fluid and waste from the body. The dialysate contains a sugar called dextrose, or a compound called icodextrin. And it also contains some minerals, calcium, magnesium, and sodium. Step 6, performing PD at home. So caring for yourself. You'll be in contact with all members of your healthcare team, self-monitoring of your health, regular clinic visits at the hospital, and telephone calls with the PD nurses. So PD supplies. So PD supplies will be delivered to your home every 2 to 4 weeks. And these are delivered from a company called Baxter. You must have space to accommodate the supplies. If you can see in the photograph, that's about how much you'll be getting at one time. A lot of our patients keep these supplies in spare rooms, in the garage, where it's not too cold, closets, or family or friends' houses. If you notify Baxter that you don't have enough space, such as you live in a 1-bedroom apartment, Baxter will let, if you have a chat with Baxter, they might let you have a 2-week delivery. There's another couple pictures of how much supplies there are in both pictures. So activities on PD. So PD allows you to maintain your current interests and activities that you enjoy doing every day. Some examples of these are traveling, sports, gardening, and exercise. Travel can occur locally or internationally. Some of our patients have traveled to places in Europe, Mexico, India, the Philippines. Some people have gone on cruises, and also we have had a few people that have gone on camping trips. Baxter will help you with your travel plans once you have been trained on peritoneal dialysis. Now I'm going to show you a video from BC Renal, which discusses some benefits of peritoneal dialysis from a patient and a nephrologist point of view. And then you're going to hear from a patient currently on PD.
I started on PD 2.5 years ago, and I did put a lot of thought into whether to go with home hemo or PD. I chose PD because I felt, I believed it to be better and gentler on your body.
You know, there's some advantages to peritoneal dialysis. We know that people who are on PD, their own kidney function lasts a little bit longer. And whatever percentage of your own kidney function you have, that is extremely important.
I've been on peritoneal dialysis now for about 15 months, and my degenerating kidneys, I have polycystic kidneys, same as my 2 brothers.
Chemo seemed a bit harder on me. I had some side effects. And of course, I was doing chemo. I was having to go to the hospital 3 times a week.
What we really want is, where possible, people start with peritoneal dialysis if they're interested in doing dialysis at home. Starting off with PD for some of the advantages that we know it has early on.
As I got into more and more into the Kelowna renal section there at the hospital in Kelowna, the women there talked to me about peritoneal dialysis, and just said it was a good option for somebody that's able to do it, that somebody that's active, and it's not only easier on your body, but it gives you a little bit more freedom. So I was immediately interested in it, and I did what research I could on it, and went through the training.
The training I received, again, it's all reassuring. Lots of practice. Start with the basics and just work your way slowly. It's not like, they rush you through anything. It's not. It's take your time. They don't want to send you off not comfortable.
It's a little confusing some days. Still need my husband to help me do it. I think I'm gonna do okay, and then he reminds me I forgot to do something.
It's going good. I'm there for all the exchanges. She was in the hospital there, so none of the nurses was really familiar with this, so I had to go in and help her because she couldn't really do it on her own, and do her exchanges 4 times a day for her. And now we're back home and things are going good.
It does make me happy just to be able to be at home, continue working. I still work, but I mean, right now with PD, I can do it overnight. So I have the whole day free. I can get at a normal sleep time and normal work time.
You know, it's pretty innocuous to have this machine working for 7 hours, and for the majority of the time you're asleep, and you wake up and, you know, unplug and you go about starting your day, and it has little or no effect on your day-to-day.
I definitely have had to adapt. There's a few things I can't do, like run, but I've adapted. I do other things now. I bowl. You know, I kayak. I get somebody else to help me with the kayak, though.
To be in Prince George, like, we started to get to know our way around down there, but it wasn't viable for us, you must well say, to move. We know everybody here.
Yeah, it's better to be at home. At least you can get better. And not in someplace that's strange. You don't know the doctors, the nurses, or any of the people that you run into.
I mean, if you live far away from a dialysis unit, it's going to be a big factor in your life. You know, it's scary enough and hard enough to be facing a serious illness, and then to have to travel, or in some cases, people have to move, which is, you know, a huge disruption in life.
Our health nurse here on reserve, she comes over and checks the wife out all the time.
Plus my family's all here, out in Prince George. I didn't really like it when I was living. We were living in our camper there for almost 3 months. And I didn't like it. I don't like city life. It's too noisy.
It's quite frustrating to sit at the hospital and have people have to take care of you all the time. And it's so much nicer where you can take care of yourself and arrange your dialysis that fits your schedule more so than having to fit a schedule at the hospital.
I'd recommend this to people that just want to be at home, close to family and stuff, without having to take 4 or 5 hours out of their day every day to go to the hospital to get the dialysis. And this seems to be working okay, like for us.
Another fabulous thing about PD is there's a lot more flexibility in your diet.
So now I'd like to introduce you to a PD patient of ours, Norm Long. Welcome, Norm.
Thank you.
Can you start by telling us a little bit about yourself?
Well, in a few weeks' time, I'll be 74 years old. My wife and I have lived in Abbotsford since 1980. We've lived in our same little home for the last 40 years. I retired from the federal public service in 2005, and we've enjoyed traveling North America in our motorhome and then just generally enjoying retirement.
That's great. How did you decide PD was right for you?
Well, my journey with kidney disease started about 7 or 8 years ago when I was on a cruise to Alaska and contracted the Norwalk virus. And so blood tests were done in the ship's hospital, and they determined that my kidney function was well below normal. And so when I got home, I contacted my doctor, who referred me to Dr. Wong in the kidney care clinic here in Abbotsford. And over the next number of years, they monitored my medications, my blood pressure, my weight. The dietitian at the kidney care clinic was able to provide me with information about a kidney-friendly diet. And the social worker at the kidney care clinic gave me information about how the disease was going to progress and how it would affect my day-to-day life. Eventually, my kidney function had reduced to the point where it was obvious I was going to have to start dialysis. So the kidney care clinic nurses invited myself and my wife in for an information session. And they provided information about the two types of dialysis, PD and hemo. And they talked about the benefits and the drawbacks to each. After my wife and I discussed it and did some research on the BC Renal site and read pamphlets that were available, we decided that PD was the best option for us for three reasons. It could be done at home, which was great. The treatment would take place overnight while I was sleeping. So it left me free during the day to do all my other normal activities. And the third thing was that it allowed us the option to do some traveling with some limitations. So that's how we selected PD.
Okay, that's great. What was it like to have the PD catheter inserted?
Because of some previous abdominal surgeries that I had, it was decided the best way of inserting the catheter for me was through a surgery here at the hospital. And that's what happened. I had no real pain after it was inserted. So it was a pretty easy procedure to go through.
Oh, that's good. What was training like for you?
I really enjoyed the training for a few reasons. It was broken up into half-day sessions so that it wasn't overwhelming with too much information all at once.
Mm-hmm.
And I liked the fact that there was lots of time available to practice the skills that the nurses were showing me. So yeah, I was very happy with the training and how it went.
Oh, that's great. And we gave you enough time to practice?
Oh, definitely.
Both cycler and twin bag?
Yeah, I started off, as you mentioned,
Yep.
with the twin bag system.
Yep.
And that went very well for a number of months.
Good.
And then it was decided I should start on the cycler.
Yep.
And I received 2 days of training for the cycler, the use of the cycler. And I liked the fact that one day was at the hospital and the second day was in our home, and we were able to set it up and practice with the nurse present. So it was great.
That's good. What changes have you made in your lifestyle or daily routine since being on PD?
Well, I guess the biggest thing that we had to adapt to was the amount of supplies that you have with PD. So we had to find room for the supplies. We cleaned out a whole shelf in our linen closet outside of our bedroom for things like gauzes and cleaning wound cleanser, all the other things, the caps. And then in our actual bedroom where the cycler sits, we removed my nightstand and replaced it with, I guess, what you would call a microwave stand that had 3 shelves. So the top shelf easily fits the cycler and the modem, and also has room for some hand sanitizer. The middle shelf we have holds the 3 bags of fluid, and the bottom shelf I have room for a basket of cassettes that we need, a box of masks, and a basket of mini caps.
Awesome. Do you exercise or swim, or how have you adapted?
Well, as far as exercise, I guess the main thing that I enjoy is walking my dog at the park. I have a 14-year-old Yorkshire Terrier who also has kidney disease.
Oh.
So we don't go as far as we used to, but we usually go about 15 to 20 minutes. The other exercises I guess I get are working, doing yard work and housework and up and down the stairs in our house. As far as swimming, I'm not really a dedicated swimmer, but we do have a boat and we do enjoy going out and exploring on the lakes and doing a little fishing. However, the last couple of years, we haven't had our boat in the water for a couple of reasons. One was COVID, but the big reason was I was afraid to get immersed in water if I was putting the boat in and out and getting an infection at my exit site. So we hadn't used our boat for a couple of years, but thanks to you and showing me the waterproof bandages a few weeks ago, I think that come spring we'll get the boat in the water.
That's great. That's great to hear. Have you had any infections on PD, and how did you manage?
I have been fortunate. I haven't had any infections, and I really credit that to the excellent training I got here at the hospital, as far as proper hand washing, use of hand sanitizer, always wearing a mask when you're
doing exchanges.
When you're doing exchanges,
Mhm.
and the importance of when you have the cap off the exchange set, the first priority is to get a new cap on as soon as possible.
Yep. No, that's excellent. That's good to hear. Have you traveled on PD?
We haven't done any overseas travel, but last September, we decided we'd like to get our motorhome and doing some camping at Cultus Lake Provincial Park. Now, because there's no electricity there, we realized we would have to switch back to the twin bag system. And so I did phone the renal unit here at the hospital and let them know that we were planning this trip, and to let them know that they wouldn't be getting information from the cycler for me for the next 4 days. And they were able to provide me with some great ideas about what types of bags I should be using, what solutions, reaffirmed that I was going to keep using hand sanitizer and mask and everything, all the rest. And so we did 4 days camping, and it worked out really well. Very happy. Felt confident about doing our exchanges at the campsite. So it was good, really good.
That's great to hear. Do you plan on doing any overseas traveling, or?
We don't have anything planned. No,
Okay.
not at this time.
Okay. Where do you keep your supplies?
We keep our supplies in our double garage. Fortunately, it was insulated and had a heating system in it prior to getting on dialysis. So last summer, though, we installed air conditioning unit in the garage just to make sure that the fluids are kept at the proper temperatures. They don't freeze, they don't overheat.
Oh, that's great. Did you find it challenging changing your own dressing by yourself when you first started PD?
I did at first. I was fortunate. My wife usually changes my dressing, but I have done my own. What I found was the cleansing of the exit site was quite easy, and to dry it. But the challenge was when you do the pillow and and the blanket. So what I adapted to was I would clean first, and then I would get everything close by, and I would lay on the bed. I would put the pillow in and cover it with the blanket, and that way, by being laying down, it stayed in place so that I could then add the dressing.
That's a great idea.
It doesn't always look as good as as what the nurses and my wife do, but it does work, and it's clean.
That's great. How has your family adjusted to you being on PD?
Well, my family's been great. My wife has been so supportive right from the start, attended all the training with me, and she's become an excellent home care nurse. The rest of my family, the extended family, my nieces and nephews have been so helpful. They come and help me with the heavier yard and garden work. My good friends have come and helped us do yard work, did heavy trimming, and have driven us to appointments. And my great niece has started the process of being assessed to be a donor for me.
That's
So I'm
so,
a pretty lucky guy.
yeah, that's great, Norm. What concerned you the most when you started PD, and how do you feel about it now?
Well, I guess I had a little apprehension the first few nights when doing the twin bag system, but what I can say is that the training and the information given by the kidney care unit and the renal unit here in the hospital has been first rate. So the training is always well in advance of the progression of the disease, so that by the time I started PD, I felt quite comfortable with the process.
Well, that's great. Thank you so much. If there are any questions for Norm and I from the audience there, please feel free to ask us now.
There's some questions. Although you had a good interview thing going here, you know, it's like you're hosting a talk show. Fantastic. And Norm, thanks for sharing. I always find that, you know, the MacGyver type solutions that our patients come up with would actually teach us things. Like when you talk the way, you know about the way you look for the dressing in the tube there. Yeah, we actually find that people have MacGyvered things we haven't figured out ourselves. You know, so that's great. Okay, so yeah, there's quite a few questions actually, and I'll probably kind of take it from the beginning of the process through to the end. Now, the first one may just be a quick one because I kind of missed it right at the beginning when I was pulling up the question. Someone had said, "Oh, you held up a book." Was it just the flip chart you were showing? They were just asking where they could access it. Was it the flip book you were showing, or which one?
Yep. So it's the
perfect.
Yep.
That's what I thought. Yeah. So this one and all the other ones are available on the BC Renal website. So if you go there, that same website I was talking to about the webinar, it's got all of our PD resources. You can just download up there as well. That's what I thought. I just kind of missed it. Perfect. Okay, so we'll go from the beginning to the end. So, you know, talking about the catheter going in, maybe just to go over it a bit, and we'll go into some details. There's a couple of different ways that people can get the catheter put in. Maybe Katie, if you just want to just quickly reiterate the kind of two different big methods we have for the catheter going in.
Yep. So one of the methods is bedside. So you would actually come to the PD unit. You would do prep before, you would hold some medications. Obviously, it's a minor surgery. You won't be put out, but you will have something to relax. It takes about, I would say, about 45 minutes. I would say the actual PD catheter going in doesn't take that long. And then also you will have to have someone to drive you home. And then we will follow up with you the following week just to check your bandage. But we will call you the next day, see how you're feeling. You should have minimal pain after. If you don't, we ask you to call us or go to emerge, but usually it's just a little bit of pain. And then the other one will be a planned surgery. And that will probably be whatever nephrologist you have will be whatever hospital. So if your nephrologist is Abbotsford, it'll be your Abbotsford hospital. And they will get, you'll have a month or so, you know, to get the catheter put in, and it will be booked, and kind of the same process, but that one, we will obviously call you the next day and see you the following week. But that one is in the OR. Perfect.
And I can add to this too, but just like to put you on the spot. What are some of the reasons that people might go into that operating route?
So they could have some hernias, they could have surgeries before on their abdomen, like you said, Norm. You had a minor surgery before,
hernia surgeries
yeah, before. So we'd have to do, we call a belly assessment before, and then we decide if you're bedside or operating room.
Yeah, perfect. Yeah, and the part I'll kind of add to this, also being one of the people who does this, sometimes is Katie, actually. Yep. You know, people find this kind of odd as to why we would do it, you know, at the bedside without all those things. the reason we often, if it's possible, it's nice to do it that way because it spares someone needing a general anesthetic. For a lot of procedures, the general anesthetic is actually the highest risk part of it. It's not the actual procedure, it's the anesthetic part. So if you can spare somebody that, that's great. So that's why we might do it. But if there's one of these more complicated things going on, you want it done in an operating room setting where the connections go inside. And yeah, and I guess there were a few questions around if you had, this or that abdominal issue, would it still be doable? The short answer there is actually most of them are still workable. Talk to your own kidney team about it, but actually a lot of other surgeries and things like that aren't necessarily reasons that, you could not have peritoneal dialysis. Perfect. That was actually a large number of the questions, so that's great. Now, there's still more, you're not off the hook yet. So then once we go in, okay, you mentioned, it came up a couple times in passing around, showering and swimming. And I think, Norm, you even mentioned, what you do, but can you maybe go over that again of if someone can swim or do water activities with the PD?
Definitely. Yep, definitely. So showers are fine as long as you remove the dressing first and then clean the exit site after. We say no baths because bacteria in the bath will get into the exit site and you can get peritonitis. We say that you can go into treated pools with caution, but we do have dressings that I actually was showing Norm a couple weeks ago that you can put over top to protect it. We say no lakes because they're quite dirty, and also oceans are okay as long as you have the covering over top.
Yeah. And hot tubs are the worst.
Oh yes, sorry, hot tubs are no go.
Yeah, and then the reason, Katie said, it might seem funny that ocean's okay. It reminds you anything that could live in fresh water can live in you. Whereas salt water is a little bit different. That's the reminder I tell my patients. If it can live in fresh water, it can live in you, And so along those lines, if someone, not from being in a hot tub, because our patients don't do that, but if someone were to get an infection, because that kind of came up, is this a really serious thing? How are we typically managing
Definitely, it can be serious if we don't treat it right away. What we do once you have the catheter in and you've started on doing your exchanges, we get you to monitor the drainage. And if it is cloudy or if you're having abdominal pain, you would call us right away. We want to get you on antibiotics. The antibiotics are usually going inside the bag. You're not taking them oral. But hopefully that won't happen if you get it, but it's good to be aware of what can happen.
Yeah, and bang on Katie's point about knowing it right away, because then if that's the case, a lot of them we can treat just like that. And actually, most people don't even have to go to the hospital. They don't have to be admitted to do that. You can do the treatment from home, but it's all about timing.
Yep.
Okay, now, so someone is started on PD. Do they have to? Do we teach everybody that twin bag system you showed before the cycler, or are people able to go right away to the machine? That's what
we usually start with the twin bags because just in case you do end up on with peritonitis, the antibiotics have to go inside the bag. They cannot go through the cycler because they won't be sitting in your belly long enough to treat the infection. Also, if the power was to go out on the machine and you need, say it goes out for a couple of days and you're stuck, then we would say, hey, you need to go on the twin bags. And we always say, please have 2 weeks of supplies at home of the twin bags. So for this reason.
Yeah, perfect. Exactly. It can be a pretty quick transition, but we want everyone to have that skill set. Okay, and then the last couple we'll maybe do together. Once someone's on PD, are they going to still be getting blood tests and, clinic visits and all that type of stuff pretty frequently?
Yeah, so once you start with us and you are finished training, we get you to go for blood work once a month. When you're here and we're starting out, we usually follow you really closely. You'll come in once a week for the flushes. We'll do your blood work here. And then once you're finished training, we get you to go for blood work. We get you to come in actually every 3 months. Once you've trained and you're good to go, you come for something called clinic. And it's basically, you will see one of the nurses, the dietitian, the social worker, and the nephrologist.
Perfect. Yeah, and it leads into, there was a question about monitoring nutritional status and things like that. And as Katie said, you'll be getting blood work and seeing a dietitian, regularly. So that's how we do that. Okay, this is like the last one, and then you're off the hook. For both all the machines and all the equipment and everything and supplies to talk about, are there costs to the patient for this?
No, everything is covered by BC Renal, and Bax goes all through Baxter, the company that I was talking about before, and you will end up ordering your own supplies, but everything is covered.
Perfect. Okay.
Dr.
Katie, oh, yes.
Could I just add something I neglected to say earlier, talking about the supplies and the volume of the supplies and stuff. One of the things that we didn't anticipate, my wife and I, was how much extra garbage we would have in the cardboard for recycling because of the boxes, etc. So what we did was we called the city and arranged to swap our medium-sized garbage bins that are picked up to the largest size available, so that took care of the problem, because we had almost double the garbage we had prior to starting dialysis, and the cardboard, amazing amount of cardboard that you have to recycle. So that was just something else I wanted to mention, because it kind of is a surprise when it happens how much garbage you have.
No, that's a really good point, Norm. And yeah, I'm glad you brought that up. Definitely people mention that. I don't want to commit to anything just yet, but I can tell you there are conversations ongoing, including with Baxter, just in terms of looking at ways of, trying to increase recycling and cut down on some of the waste associated with it. So in other words, it's something that I think the manufacturer is even looking at, because I think people are becoming more and more aware of just how much this generates. I don't want to promise anything yet, but I can tell you people are paying attention to it. It's something we're becoming more aware of, right? Of the environmental impact of some of these things. Yeah, in addition to the practical one, like you said, of just you need to dispose of it.
Yeah.
Okay, Katie and Norm, I think you're off the hook for a bit. There might be some more questions at the end, but you can now sit back and have your coffee, or if you like. And now we go over to Sarah and Val for home hemodialysis, our other home treatment.